illness. Now you get to know as I continue this presentation why I actually, did my and why I called it the big illness. So these are my outlines. Feel free to unmute your mic and call my attention if you can't see my screen or if you can't hear me. Thank you so much. So my outlines are introduction, burden of the disease, types, symptoms, diagnosis, treatment, complications, and prevention. In between, I'll be introducing the myth of diabetes. So just listen carefully. If you have questions, note it down. I'll leave in between the presentations. I'll also give opportunity for questions. Okay, now we move. Introduction. What is diabetes mellitus? That's the big name of this chronic illness. Diabetes mellitus. Now, diabetes, forget about all this grammar here. I'm going to, break it down in little bit so that you understand every single one of it. Now, diabetes is a chronic disease. When they say that something is a chronic disease, that means a disease that lasts for so long. It's a disease that once somebody has it continues on for a very long time. Now, not just it being a chronic illness, is a metabolic disorder. When they say metabolic disorder, that means it's a disorder that has to do with how the body breaks down, the things that we eat, the normal processes of the body. Something that has to do with how the body, acts, the normal processes of the cells and all that. So when they say something is a metabolic disorder, it has to do with the function of the body, how the body, uses up what we eat and however we, all the breakdown of food and all the many things that we consume. So it's a metabolic disorder. Now, another thing you need to know about diabetes is that it has a lot of cause. So if you see someone that is diabetic, we cannot particularly say that this is the particular cause of it. The causes are multiple. Now, all these things, it being chronic and it being a metabolic disorder, all focuses on how the body is not able to break down carbohydrates, fat, and protein. Now, if you look at this definition, you see that we're not just talking about sugar now. We're not just talking about only carbohydrate now. You're seeing that inability of the body to break down carbohydrate, fats, and protein. Watch this carefully. Inability of the body to break down carbohydrate, fats, and protein. So that is the thing. The body is not able to break down fat and protein because of all the things that may have caused all the whole disarray of those metabolism. That is the thing. And there's one thing in the center of this inability to break down this carbohydrate, fats, and protein. What is in the center, the particular hormone responsible, is called insulin. It's called insulin, and diabetes is centered about how insulin acts in the body, how insulin acts in the body, centered around it. So when there is an issue, it's all centered around insulin, So that is one thing you should know. So when you're talking about diabetes, our focus is on the hormone called insulin. Our focus is on the hormone called insulin. Just give me a minute. Let me admit some more people. Okay. Okay, so we'll continue. Now, the burden of diabetes in Nigeria is something that we cannot, it's something that is very, very huge. Like where was it? The link that I sent on the group about diabetes, to let us know that it's something that it's a disease that is very, very prevalent in Africa, especially Nigeria. It is very, very prevalent in Africa, especially Nigeria. Now, Nigeria itself has the highest number of people coming down with diabetes in the whole sub-Saharan Africa. We have the highest incidence of of diabetes in the whole sub-Saharan Africa, Nigeria. That is to say that for every one person that has, we have like one person that has diabetes in every 17 adults. That's to show you how prevalent this is. And from research, it has been shown that most of the place where they have, conducted studies and found out that we have a lot of people with diabetes is mostly the South. Much to our what we would think, because if we use the general knowledge, you say people where they chop sugar too much, we will say that the Northerners eat a lot of sugar. They eat a lot of sugary foods and all that. So you should be expecting that that there should be a lot of diabetes in the north. But you see that the highest prevalence we see are in the south out. Sorry, please. Google Meet. Just give me a minute. Sorry, please. Just give me a minute. A lot of people are joining on, so you need to admit all of them. Okay, so we're back. Can you see my screen now on Google Meet? Yeah, so we proceed. So we have like I said, we have the highest prevalence in South. So and we also have the highest death rate in the whole of sub-Saharan Africa. That's about 4 million deaths a year from diabetes. So that's to show you how bad the disease is, and all that. So we go to the next slide. Now, the next slide. We have various types of diabetes. We have type 1 diabetes, we have type 2 diabetes, we have gestational diabetes, and we have secondary diabetes. Now, for type 1 diabetes, those who are born with diabetes, as in it's diabetes that happens mostly in childhood. It's mostly discovered in childhood. It may not even be that the person is born, but it actually starts to show, at the early stages in life. Let's say less than 10 years, the child starts to show symptoms of diabetes. In this type 1, we see that it's not a problem of the insulin being available. The problem, the problem in type 1 is that the insulin is not enough, or is not even there at all. There's no insulin to actually act and break down carbohydrates. So in this case, you have to treat with insulin, so that is the problem in type 1. Now, type 2 is the adult onset diabetes. Now, we have various types of type 2, but I'll just let you know just type 2. Now, type 2 is not the problem of insulin being there. Insulin is there. We have insulin in the system. Everybody has type 2, has enough insulin, or they may not have as much, but the problem is that the body doesn't respond to insulin as it should. The body doesn't respond to insulin as it should, you know. So that is the reason why diabetes is we have that type 2. So I will talk about it more. So type 2 is that there is insulin, but the body is not responding to the insulin as it should. So we have a problem of sensitivity to insulin. Now for gestational diabetes is diabetes seen when someone is pregnant. So you see a pregnant woman who has never been diabetic before, then during pregnancy, she suddenly becomes diabetic. It's very, very common. It's pretty common. So that's why it is classed as a type. Now, the last one is secondary diabetes. Now, this secondary diabetes occurs when the person probably was not previously diabetic and then becomes diabetic as a result of some other disease. Let's say the person has pancreatitis now, and the pancreas gets destroyed. You know, pancreas is the organ that produces insulin, and all of a sudden the person now becomes diabetic due to that. Or the person takes a particular drug that counteracts the action of the insulin, and all of a sudden the person becomes diabetic because the person is taking that particular drug. Or the person is exposed to radiation and all of a sudden becomes diabetes because of that exposure. So that's why secondary diabetes. So something else is causing the diabetes, not just that the diabetes just comes up like that. Something else, because then when you treat the cause of that diabetes, the diabetes tend to be, you know, cured and all that. So that's secondary diabetes for you. Now, the next thing I'll be talking about is the the causes and risk factor. Now, in most cases of diabetes, it is difficult to pinpoint one particular cause of this illness in individuals. It's difficult to actually pinpoint one particular cause. Some people might have a lot of factors going on at the same time, you know, that may have caused this diabetes. They may have a lot of factors going on that may have caused this diabetes. Some people, it may be that they have a family history of it. At the same time, they're also exposed to an environmental factor which could have caused it, or the fact that they may have been maybe obese or something, or even their nutrition together with all the other factors too comes together to cause it. So we may not be able to say, oh, this for this person, this is particularly caused. It has to go to genetics. So there's some people, you know. So most of these causes cannot be pinpointed as, oh, for this person, you know, this is the one thing that caused diabetes. So know all the causes so that these causes, knowing the causes can actually help us to know when to prevent and how to prevent the disease, you know. So
doctor, please, 1 minute. Please, can you make me admin on the Google Meet so I can be handling the admitting people to come in and all? Because they say a lot of people want to enter.
How do I do that?
Like co-admin, co-host. I don't know how to do it on Google Meet, but since you created the link, only you can do that.
Please give me 1 minute, please.
No, no.
Which are I'm here to see you on this Andy, what's your name on Google Meet?
It's Randy, just Randy Abba.
This thing is giving me a lot of issues.
Okay, that's just very impressive. I think maybe you should just click on my name, the like the three dots on my name, then probably you see that option.
I tried that before, I didn't.
I'm wearing some wizard cap with my gray beard. It's not easy.
Okay.
Can't you see? Well, if you can't see it, let's just continue now. No worry.
There's no admin as in.
If you can't see it, no, voila.
Hmm.
Let's just carry on. Okay.
Let's continue. Just
I'm
manage it.
waiting.
It's not bringing up the option of admin.
No, no problem. No problem. Just carry on. Carry on.
Okay, sorry for the delays. Let's just continue. Well, let's continue. Eh? We're trying to get a co-admin to be adding people to the call. So just pardon us for the whole. It's crazy. Okay, so I'll continue. Yeah, laptop. Seems this call is so large. Laptop is. Okay. So back to that. So we can most of the times there are multiple courses, like I said earlier. So just look at this the courses that I've but most of these courses that I've highlighted here are like the most common courses that you can see. The most common courses, for diabetes. Um, this an idea of these courses can actually help you when it comes to prevention. So take note of that. So the next slide. Now the myths. Now I want you to listen to this part carefully because I actually wrote out this myth based on the misconceptions that I've had throughout my practice, as a doctor. So that is it. So now the first myth is it is a disease of old people. Now, diabetes is not a disease of old people. I've told you that there's type 1 diabetes, so that can occur in early childhood. So it is not a disease of old people. Right now, we have a lot of young people coming down with diabetes. Now, the environmental factors are so alarming that a lot of young people are beginning to come down with diabetes. The lifestyle changes, the genetics, so many things. We have a lot of people who are 30 something coming down with diabetes. So diabetes is not a disease of old people. Now, the second one is that diabetes is caused by eating too much sugar. Now, this is a very, very it's one notion that has been conceived by a lot of people, So when they come to the hospital and you tell them you are you are diabetic, they will tell you that no, I know they chop sugar, I know they chop sugar, how I can be diabetes when I know they chop sugar. It's not about whether you chop sugar or not. If you have the factors to be diabetic, you're going to be diabetic whether you eat sugar or not. Now take yourself back. For example, remember I talked about when I was defining diabetes, I talked about um, metabolism of both carbohydrates, fats, and protein. So it's not all about the sugar, the raw sugar that you use to drink your tea. It's not all about the raw sugar that you use for your tea and for your paps and all that. I'll talk more about diet later. So it's not about how much sugar you eat. If you have the factors to be diabetic, you're going to be diabetic. It's not about whether you eat too much sugar or not. You've seen it. Research has proven it. In Nigeria, the people that eat the most sugar are northerners. But you see that the highest prevalence of diabetes are seen in South, among the Southerners. So that's the thing. So take that. Now the next thing is, those who are diabetic should avoid carbohydrates. This is not true. Those who are diabetic are not supposed to avoid carbohydrate. They are only supposed to reduce carbohydrate, not avoid. Now, hold that thought there, because I'm going to talk about that later when I talk about diet. So hold that thought there. So now, another myth says, oh, nobody in my family has diabetes, so I cannot be diabetic. Yeah, you can be the first in your family to actually come down with diabetes. Now, there's a precursor to diabetes. There's some people who have pre-diabetes. Somebody in your family may have pre-diabetes, and all that. And who knows, our family history here is not always very, very perfect. So that most of us, we don't even know we've never seen our great grandparents or our grandparents. So how can we confidently say that none of them were diabetic? Most of them never even went to the hospital. Many of them died young. So how are we supposed to say that they are not this or they are not that? So you can't be so certain that nobody in your family has diabetes. That's one thing. And the fact that nobody in your family has diabetes does not mean that you cannot be diabetic. You can be diabetic when you have factors that makes you diabetic. Now this last myth is something I will talk about more later, but take note of it. Some people say, I am diabetic, or I'm diabetic, or is only if I'm diabetic, so it's only beans and unripe plantain and acha I'll be eating. No, that is wrong. That is a wrong notion, to hold on to. I'm diabetic. It's only the doctor has said that I should be eating only acha. I should be eating only this. I should be eating only acha. I should be eating only this. Oh, please hold on just a minute. I don't know why my system keeps crashing. I would advise you also join the YouTube so that we can continue, even if the Google Meet doesn't work. We can have other platform, other stuff to continue. So I'd advise you also join the YouTube link too. Yeah, so I'm diabetic. I should only eat only beans, unripe plantain, acha, or wheat, and all that. I say, the fact that you're diabetic does not mean that you should restrict yourself to such a diet. I will talk about that later. So so we go on. Next slide, please. Randy, help me out. Next slide, Randy. Next slide, Randy. Okay, so next slide should be the myth still. There's some people that have that myth that once my blood sugar is normal, I should stop taking my medication. That is not true. So once your blood sugar is normal, it means that what you did to make it normal, it's good. So keep doing it. Then another myth says, when my sugar is high, I just take bitter leaf and it's come down. People do this a lot. You just took bitter leaf and it will come down. Did you actually check your sugar level to see that it actually came down? You understand? So this is not right. So I will tell you more about that later. Then some people believe that when my body used to show me sign, when my body used to show me sign when my sugar is high. Some people don't have signs and symptoms. We'll talk about it. Some people don't have signs and symptoms. So please don't rely. This is a chronic illness. Don't rely on the fact that my body used to show me sign. No, please. The only way you can know when your sugar is high is by checking with a glucometer. I will talk about how important is that later. Now, another thing is that they said this supplement or that supplement can cure diabetes. Please don't fall into that trap. Diabetes is a chronic illness, and I'm going to tell you how disastrous it is if not diagnosed early and treated early. So please don't listen to anybody that will tell you that any supplement can cure diabetes. Just whenever you found to have diabetes, go to the doctor. Now, the last one in my meet says, doctor put me on insulin. That means my case is the worst. No. Note that insulin is the best medication for diabetes. So the fact that doctor put you on insulin does not actually mean that your diabetes is the worst. Insulin is also a drug that treats diabetes, and it's a very good medication for treatment of diabetes. So I will talk about all that later. Now for the symptoms. Next slide. Now, like I said earlier, symptoms, diabetes can come without symptom. Some people can just be walking around with diabetes and they don't know that they have diabetes because they don't have any symptom. We've discovered a lot of people coming down with diabetes, and it was when they went for maybe one outreach or the other that they found out that they were diabetic, or maybe they went to the doctor for something, and the doctor just say, okay, let me just do your blood sugar, and they did the blood sugar, and all of a sudden they found out that they're diabetic. So so the fact that somebody doesn't have symptom or sign does not mean that he cannot be diabetic. He or she it can be discovered on a routine health check. That's it. Now, the major signs and symptoms that one would have once your sugar level is high, once you're diabetic, are excessive urination. You notice that you start to urinate very, very often, especially at night. Normally at night, you have to urinate, you may urinate like 2 times at night, but you see you're urinating more than 3 times, 4 times, 5 times at night, and even during the day. And not just urinating, but you're urinating in large volumes. So you have large volumes of urine. Now, another thing again is increased water drinking. Now, obviously, when you urinate, you're losing fluid. So, of course, it can make you dehydrated and you want to drink more water. So, this is a symptom. So when you see somebody urinating excessively and always wanting to drink water all of a sudden, pinpoint, it may be diabetes. So it should be checked. Person should go to the hospital. Now, another thing is excessive eating. There's this thing that high sugar levels always stimulate appetite. So you see that people with diabetes always want to eat. They are the ones that always want to eat. They want to eat everything. And you know what follows when you eat everything. It follows weight. They can be weight gain. It follows it, weight gain and all. Now, another thing again is that there's some diabetes, especially type 1 diabetes. Type 1 diabetic patients, most of them are not on the big side. They are slim, and also it may not be that somebody must be, must have lost weight. Somebody can lose weight, and somebody can also gain a lot of weight when one is diabetic. It goes both ways, and all that. So another thing again is fatigue. Person is always weak, and all that. Then you have frequent infections, so much boils, too much boils. Every time you're having urinary tract infection, you cannot even explain where it came from, vaginal candidiasis, mouth ulcers, so many illnesses. So many, all of a sudden you're having an abscess somewhere, a big, something that is bringing out pus, and you cannot tell as in how it came about. So once you start having those things, please put an eye and make sure you go to the hospital and check your sugar levels. It won't take anything. Next slide. Next slide. Now, so this diagram just shows us more of it, and all that. You can see blood vision there too. When sugar levels are very high, you see that the person will be having blood vision. You can see some symptoms can also be as a result of complications of diabetes itself. You see that the person will have an injury that will refuse to heal, and all that, and all of a sudden the person is suspicious. They're like, okay, I go to the hospital and they check your sugar level, and it is hitting the roof. So those are the basic symptoms that you see mostly once somebody comes to the hospital and complains and says, I'm urinating frequently, I'm drinking a lot of water, and they say, oh yeah, it may be diabetes, let us check your sugar level. So that is it. So once one goes to the hospital, next slide, and you come to the hospital, the first test they want to do for you is they want to do your fasting blood sugar. It is very, very important. These are tests that are standard for for making diagnosis of diabetes. Standard is the fasting blood sugar. Then random blood sugar is the one that we do mostly when we go for outreaches, where we check your sugar level, even though you've not fasted, we just check your sugar level. It is most preferred test for outreaches and all that. There you can, so if you see somebody that has a high level sugar in any outreach where you have checked the random blood sugar, what you want to do is that you want to tell the person to go back to the hospital and do the fasting blood sugar, and then the other test that is there called HbA1c. These tests are like standard, and they will also give us an idea of whether the person is diabetic. We can make a diagnosis of diabetes, or not. Now, oral glucose tolerance test is mostly used for those who have diabetes in pregnancy. Oral glucose tolerance test for diabetes in pregnancy. So these are the tests that you will be seeing most likely in the hospital when you go for the reason, as in if you're suspected to have diabetes. Now this next slide actually shows what the levels will be for them to say, oh, you are in this stage or in this stage. I had to bring out this slide because I want us to know that apart from being diagnosed diabetes, some people can go to the hospital, and they may not have full-blown diabetes, but they may be in between. They say it's in between the devil and the blue sea. In between. So when you have figures in between, there are things that you have to do to make things better so that you don't become diabetic. So that's why pre-diabetes is something that we always look at. So when somebody goes to the hospital and you check your sugar levels, and your sugar level is not high as per, they will say that you are diabetic, but it is higher than the normal range for people of your age and all that, then they will class you in pre-diabetes, and they'll begin to counsel you, to start to take lifestyle precautions, or else if you don't do so, you may become diabetic. So that's at that stage, it's pre-diabetes. So these are like the values, I'll post this slide later so that you see the values. These are like what the lab tests will show you if you're in the range of pre-diabetes, and this is what the lab test will show you if you're range of that of diabetes. Now, what I want people to understand is, now if you're checking your sugar level, if you're checking your sugar level maybe at an outreach, or you're checking your sugar level for your mother or father, depending on the kind of glucometer you're using, and the sugar level you check is more than 11.1 or 200, depending on the type of glucometer you're using. Once you get that kind of figure, it means that the person is diabetic. That is diabetic range glucose. Once it is more than 11.1 or more than 200, note that is diabetic range, and all that. So if the person is already diabetic and is on treatment, and he keeps getting sugar levels more than this 11.1 or 200, it means that the sugar level is not well controlled. And if the person is not diabetic and they now check on more than one occasion, and the person has sugar levels above this range that I just mentioned now, that means the person is diabetic. So take note of this, because this is very, very important. Now, when one is now diagnosed of being diabetic, what can we do to make the person better? Now, like I said before, diabetes has no cure. So don't look out for the goal of management is not to look out for cure, but the goal of management is, number one, to reduce symptoms. We want to reduce symptoms, of the diabetes. We want to promote well-being of the person who is diabetic. We want to prevent complications. I have a slide on complications. I'm going to talk about it, and all that. Then we also want to delay the onset or progression of, so if a complication has set in already or is about setting, we want to delay the onset of it or the progression of it. So that's it. So that is the goal of treatment of diabetes or management of diabetes, basically. So you've seen that in this goal, we did not talk about cure or anything. So hold on to that. Now, there are so many medications for the treatment of diabetes. That is why diabetic medication can never be over-the-counter medications. Never. Can never be over-the-counter medication. I know why I'm saying this because I had a relative who was diabetic and was going to the chemist to go and get diabetic medication. Diabetic medications are not what you go to chemists to go and get. Now, there are so many of them, and each of them have their peculiarity. So it's only a doctor, after doing all the tests and all that he needs to do to check you up, that can tell you which of these drugs are suitable for you and place you on this. So you can't share drugs with somebody that's diabetic, even if now this one that they give me for diabetes, you now say, okay, give me this one. You can't share. You can't share. It can't be the same. If it's not the same drug, you can't share. So take note of this. There are so many medications and there are so many indications for prescribing these medications. So you can't just take anyhow, like even insulin. There are different types of insulin. So you can't say because they are giving this person this particular insulin, then you now go and take it, because meanwhile your own insulin is different from that other person's insulin. So take note of this. So we can't share any medication, or you can't go to the chemist who doesn't understand things about it to go and be purchasing medication. You must go with a prescription from a doctor after you have been checked and everything to find a medication that is suitable for you. Next slide. Now, management of diabetes is not something that only one person can do. It is an illness that requires a multidisciplinary approach. So it's not just you seeing the doctor. You have to see the nutritionist, diabetic educator. The lab science is important here. The pharmacies are important. The family support people are important. The physiotherapists are very, very important. Different support groups are important. So if you're managing diabetes, it is once you are diagnosed of having diabetes, you can't even be going to an ordinary GP. You must be seen regularly by a specialist, because the only specialist that can direct you to each and every one of these other disciplines, that at each and every point in time when all those supports are actually needed from the other disciplines. So for anyone to manage this long-term illness called diabetes, all these disciplines have to come together to make sure that the management is smooth and you as a person enjoy the quality of your life. Next slide. So this is insulin. So I'll be talking about insulin basically here. I'm talking about insulin. So next slide. Insulin is the best and like the first diabetic medication that was discovered. It is suitable for both type 1 and type 2 diabetes. It is suitable for all types of diabetes, but type 1 mostly are the ones that use insulin more than the type 2 patients, and all that. Even for the GDM, even for gestational diabetes, that's diabetes in pregnancy, insulin is a suitable treatment, and most of the time it is usually those who use the insulin, it is usually injected under the skin, subcutaneously. So we have different types. We have the rapid acting, we have the short acting, we have intermediate acting, long acting. So when you go to the hospital and the doctor prescribes insulin, it's good for you to have what type of insulin is this, so that you will know that this is the type of insulin you are using, and you will not go and think another insulin is another insulin. When you go and buy your insulin, somebody will now give you another insulin instead of the type that you normally use. So it's very, very important for you to understand the type of insulin that you've been placed on, so that you can know which one to use at each time, especially when you're refilling your medication. Next slide. Now, it is important to also note this, that the best sites to admit for those who have type 1, the best, and all those who have relatives that have type 1 diabetes and also type 2 that are on insulin, it is important for you to know the best site, because most of the time, most of these people, they require people to actually help them administer their insulin. So the best sites to actually administer insulin is the abdomen, followed by the arms, the thighs, and then the buttocks. So note this, so that in case if your sister or something, they have to teach you to administer insulin to somebody that is living with you that has diabetes. It is very, very important to know which sites you can easily administer this to, and to the person. Now, it can also be administered. It should be administered at room temperature. So normally we know that insulin is stored in the fridge. So if you store your insulin in the fridge, before you take it, you should bring it out for a while so that it becomes like room temperature before you actually inject it. So if you have to take your insulin, and insulin administration is usually timed. So most people that take insulin know that they take it at a particular time. So when that time gets to that time, you can bring it like 30 minutes first, so it can thaw and get to room temperature before you can actually administer. Now, insulin, I need to say this because most people that are insulin get this scare, especially in Nigeria, where we know our power problem is terrible. Insulin can actually last up to 30 days in room temperature. You understand? Insulin can last up 30 days. It's not even safe. You will destroy the insulin if you put the insulin close to where it will get in the freezer, where it will get frozen. It will be kept in the freezer door. I'll talk about that later. It should be kept in a fridge door, not freezer, please, not freezer, fridge. It shouldn't be too cold. And it can actually last 30 days in room temperature. So if you're on insulin, don't be scared when NEPA takes like for 2 days or 3 days. Your insulin is still fine. Next slide. So that's it. Do not store your insulin near extreme heat or extreme cold. So when you bring out that insulin, please let it not be under direct heat, and let it not be stored in extreme cold. Like I told, don't store in the freezer. Like I said, some people forget their insulin sometimes in the glove compartment of their car, and you know how warm these places can be. It's not safe to store it there. Now you have to check the expiry dates. If you've had the bottle for a while, make sure that you're not taking something that's expired, and make sure that the insulin looks normal. Like the regular insulin is usually clear like water. It's usually clear like water. But the mixed insulin, some insulin are a mixture of both long acting and intermediate acting. So those ones are usually cloudy. So if you were taking a regular insulin and it was transparent like water, and all of a sudden that regular insulin starts to become cloudy, you will know that yes, it is not looking normal. So you can't be drawing that into the syringe. So you should defrost it. So look out for discoloration, particles, frosting. Once you see any of this, maybe when you were buying it, you saw that, just discard it. You don't need to take that insulin. Next slide. Now, it's also important for you to know that even as people take insulin, there are also complications of insulin use. So like insulin, the major complication of insulin is that it makes the sugar to go down very, very low. That is why when you are placed on insulin, your sugar will be monitored so that they are sure that that dose of insulin that they placed you on will not bring down your sugar too low. So that's that too, so that you won't, because we fear low sugar also the same way we fear high sugar, because somebody can sleep off and have very low sugars and pass on in a sleep. So, and insulin, that is major complications of insulin use, hypoglycemia. So any dose that you're giving, you must make sure that you take it at refill, because if you take higher dose than you're supposed to be giving, it can bring down your sugar. Also, that is the reason why people take insulin before their meals. You have to eat. You have to take your insulin, then you eat. So that the insulin will act on the food immediately. Don't take insulin on an empty stomach. You have seen people who collapsed and lost consciousness on the road just because they took their insulin without eating, hoping that they were going to rush and eat. And while they were rushing to eat, the sugar level crashed and they collapsed. So take note of that. Now, another thing is lipodystrophy. That's the fat distribution will not be good, especially in those places where you inject the insulin. This is because this is mostly caused when the injection is not well applied. Some people can also have allergic reaction to the insulin, and sometimes local irritation to the insulin. So take note of that. Then, like I told you, we have other medication. These ones are like the tablet medication. Next slide. That's like the next slide. Yeah, so these are the lists of the tablet medications that we have. See, they're like more than how many here, and so much more is being discovered every day. Research is going on every day to discover more and more of these tablets, these sulfonylureas, meglutinides, biguanides. They have so many of them. So, and each one has the reason why it is given, so doctor has to check you, do some other tests, check your kidney level. There's some of them that you can't give it when the person's kidney is down. You can't give it because to worsen the kidney problem. There are some of them you can't give when the person is on the big side. You will make it can make the person add too much of weight. There's so many of them. There are some of them that you can't give to somebody who has heart issue together with diabetes. So each one of medication has their indication. So don't you see that the drugs has to be prescribed by a doctor, and all that, and based on his observation and examination of you and everything about your system and all that. Next slide. So there's this one I want to talk about. This is this insulin pump therapy is almost like a modern day I like it now, modern day management of insulin. It's not so common in Nigeria, although people are beginning to get the hang of it. It's just like an automatic pump that is attached somehow and connected to the skin or somehow under the skin. Now this machine records your blood sugar and then gives you insulin based on your blood sugar level readings. You understand? And it also senses when your blood sugar level goes high. Once it senses that your blood sugar is high, it is already programmed to give insulin. We have the popular name of the one that is known is Dexcom. It's quite expensive. Many people down here, they have this. Many people in the foreign space, they use this, especially those with type 1 diabetes. So they don't stress themselves, don't use too many needles. All they just need to do is to implant this device, and it gives them programs, check their sugar levels, and also give them insulin depending on how their sugar level rises. So that's the new technology for insulin, for blood glucose management. Now, self-monitoring of blood glucose, this is also very, very important because, like I said, number one, diabetes is a chronic illness, it's a long-term illness. And also, you will not know, like I said, when your sugar level is high. So the only way you will know when your sugar level is high is when you check your blood glucose level. So I always advise every person who is diabetic to get a glucometer. Now, if you have anybody who is diabetic around you, the best thing you can do for the person this Christmas is to get the person a glucometer, and apart from that, the strips are quite expensive. So even if the person has a glucometer already, you can as well sew into the person's life strips for the glucometer, so that the person can be checking their blood glucose level. So a person can be checking their blood glucose level, and all that. So so it is very, very important, for that. So glucometer, it is key. If one has diabetes and you want to manage your diabetes optimally, you must have a glucometer. Now, this is the benefit you get from having a glucometer. If your sugar level is high, it will help you monitor your sugar level. Now, for example, if you have somebody who is diabetic now, and you check your sugar level, and your sugar level is very high. Tomorrow you check your sugar level and your sugar level is very high. Tomorrow you check your sugar level, and you've been taking medications. What will you do? You will want to rush back to the hospital and like, I've been taking my medications, but still my sugar level is still high despite the medications I've been taking. So it is very, very important that you're monitored. You use the glucometer because it helps your care to be better when you don't assume that your sugar level is high, but you actually check and you record. So most of our patients who are diabetic, we advise them to get a book and record their sugar levels. Apart from that, it can actually give you a picture of how much glucose load is introduced in your system after you eat. You know, so you can actually even use it to test out your meals. So once somebody eats eats a food and check your sugar level, and sugar level is 2 hours after eating and your sugar level is very, very high, it tells you that that food that you ate really introduced a lot of sugar. Maybe next time when you're eating, you try and tone down the carbohydrate a bit. You know, it can give you more insights to how to, you know, manage diabetes generally. Now the next slide. Next slide. Okay, yeah. So diet now. Now I don't want to stress people so much. I don't want people to stress yourself too much, because we've noticed that the major cause of problems with persons with diabetes is the fact that they don't know what to eat. Is the fact that they don't know what to eat. You know, that is the major thing. So when you're diabetic, don't stress yourself. Don't even kill yourself. Don't even worry yourself. What you need to do is you can still eat the same thing that every other person is eating. Don't break your head about it, because let me tell you, this thing has been the cause of a lot of depression among our diabetic patients. If I tell you 95% of the times when I see a couple come into the clinic with me and the man is diabetic and the woman is not diabetic, for example, and I see a frown on the man's face, the next thing I'm hearing is, "Doc, they don't allow me eat anything, no. They don't allow me eat anything, no." And I'll be asking why. What is the issue? No, they like to chop this one. They like to chop this one. They like to chop this one. They like to... Hey, I will now start teaching and talking. So now you're going to listen to me carefully in terms of this diet. I'm going to shock everybody here, because forget about what you know. Just change, as in trash and crash everything that you know about diet. You see, diabetes. If you're diabetic, you can eat everything that every person is eating. So your diet don't have to be different. They don't have to cook food for you separate, you know, and your life does not have to be about beans or wheat or plantain or this or that. No. Now, listen to me carefully. The only difference between the diet of somebody that is diabetic and somebody that is not diabetic is that the amount of carbohydrate that somebody that is not diabetic will eat will not be the same amount of carbohydrate that somebody that is diabetic will eat. The amount of protein that somebody that's not diabetic will eat is not the amount of protein that somebody that is diabetic will eat. So in that wise, cut down the carbohydrate, cut down the protein, and increase the vegetable and the fiber. Shikena, very, very easy. Is it difficult? Is it difficult? Is this difficult? Reduce the carbohydrate. So if you like eba, you are diabetic, you like eba, you want to eat eba, no problem, you can eat eba. But what we are saying is, you don't need to eat 5 wrap of eba. No, just a small portion of eba with your plenty increase the soup, plenty of soup, you know, and that is it. So your life doesn't have to revolve around eating only beans, eating only plantain, eating only this, eating only... No. It doesn't have to. It does not have to revolve around that. So Take notes. Next slide. Next slide. Let me show you something. Now look at this. Look at this slide very, very well. You know, when you look at this slide, you see, like this slide just gives you an idea of what it is. It says eat all kinds of vegetable, like a lot of vegetable. You see, if you look at that circle in the middle, it just shows you the size of plates. Let's imagine that is a size, that's the size of plate, a 9-inch plate, you know. Half of your plate will be vegetables, while the other half can be a combination of the carbohydrate, the protein, and a little of fats. And that is it. That is an ideal diet for someone who is diabetic. Simple. What did I say? Half of your plates. So you see that food you used to like. If your best food is, okay, let's say your best food is rice. Half of your plate of rice should be vegetables, different types of vegetables. The remaining half should be a combination of that small rice, small protein, you know, and the little fats and oil that you used in cooking the rice. That is the ideal diet for you. So you see, you are increasing the vegetable and the fiber content in your food and reducing the carbohydrate content and protein. If you understand this principle, it gives you an idea of what is the ideal diet for one who is diabetic. But we are not done there. We are not done with that yet. Now, next slide. Note this point. Beans, which is the most favored. Some people say, hey, beans, so everything is beans. Some people eat beans flour, beans swallow, beans this one, beans that one, beans that one. They say is this thing. Sure, I had a patient that when you check your sugar levels, every time your sugar level is hitting the roof, and we tell you, doctor, I know they chop any other thing apart from beans. So only beans are the chop. We say, okay, when you want chop the beans next time, make I see the food. He now brought the food. Oh my God. If you see the heap of beans, the quantity of beans, if you see the heap of beans this man was consuming, you know, and you'll be wondering, there was no vegetable, there was nothing inside, just beans. And the sugar level was very, very high. You understand? So you're not be wondering why. Now, beans is no longer classed under proteins, as we taught then in primary school. Beans is protein and all that. Yeah. Beans is classed under starchy grains, starchy vegetables. That's where beans is classed under. So if you're eating beans, please treat it as a carbohydrate food. That's number one. Number two, plantain, which is the most favored. Some people, they will eat plantain. They say only plantain flour, only plantain. Now, let me shock you. Plantain is carbohydrates, no doubt. See, it doesn't even contain as much fiber as we think that it should be the number one, source of carbohydrate on the top of our list, and whether you eat it unripe or you eat it ripe, it is still the same carbohydrates. Let me shock you. It is whether it's unripe or not, so it is still the same carbohydrate. So stop deceiving yourself. I'm eating plantain. You feel the bowl of plantain, and your sugar level will still not be controlled. It's not about the food. It's not about the type of food. It's about the quantity of the food that you eat. It's no longer about the type of the food that you eat. It's now about how much of that carbohydrate that you are actually eating. You understand how much of it that you're actually eating? Now, it is not so hard. So you don't have to go about looking for oats, this one, that one, all this Oyibo food to come and eat. No. You can work with our local foods. All you just need to do is to reduce your quantity of food. As one who is diabetic, you must learn how to be satisfied with eating a small plate. You see those kind of platter you see in when your people say I'm eating dinner, and you see those small size of food. That's the size of food that you should eat. Not you say you are eating food, you go and carry 10 wrap of akpu. 5 wrap of gari, say you're eating. As diabetic, you need to reduce the quantity of starch. When I say reduce, I mean reduce. Some people prescribe that your swallow should not be more than a fist. But this is what I prescribe. I'll say test out your food. That is where the glucometer comes in. You know, I know somebody who eats normal like every other person, and she's controlling her diabetes and taking her drugs regularly, everything is fine, you know. And when I asked, it still boils down to the same thing. I know what I eat, the size of what I eat, you know, and all that, and that controls my sugar level. So when you eat your food, in order to know that that food is the right food and size and portions for you, you have to check your sugar level 2 hours after eating that food. Now, if you check your sugar level 2 hours after eating that food, and your sugar level spikes up, is is high, it shows you that that food is too much for you. So you have to reduce more portions and try it out again. So you keep testing out your foods like that until you get the right size that is good for you. And then when you know the right size of different kinds of meal combination, the different size of meal combinations and all that for you, when you know the right size, it will now help you to know, even when you are not even in your comfort zone, you'll be able to know what size of food to spoon in your plate. Well, let me, when you get to a party, you won't be careless. You still know that, okay, this is the quantity of rice I used to eat that my sugar level used to be okay. So this is the quantity. So you don't even need anybody to tell you. You know the quantities that you can eat, and sugar level it's not about whether it is basmati rice. Do you know that you can eat basmati rice and your sugar level will still shoot up? It's about the quantity of the basmati rice you eat. So note, it's not about the type of food, it's about the quantity. Now, the next thing is avoid sugary drinks. Now, this is the reason why you should avoid sugary drinks. Sugary drinks are refined sugars. They are refined sugars. Now, refined sugars, they are simple carbohydrates. While your normal foods, all and all that, swallow and all that, are complex carbohydrates. Those sugary drinks have simple carbohydrates. Now, what does simple carbohydrates do for you? When you take them, it spikes your sugar level, and can put you in a coma. You understand? So that's why it is advised that you avoid sugary drink, because they can cause a high spike in sugar level and can put you in a coma as fast as possible. So that is even the more reason why we even prefer smoothies, because smoothies has the fibers and all than juices that all the fiber has been squeezed out from. Smoothies are preferable to juices. It's still the same reason. The fiber and all actually helps you take the fruits without feeling the sugary impact of the fruits, than when you take the juice. When you take the juice, as if you have sieved all and you are taking out the refined sugar. So you are drinking it, and it will cause a spike in your sugar level. So that is why sugar drinks and juices are not are one thing they said, as in you should avoid. So take note of that. Next slide. Next slide. Now, complications of diabetes. Now, this is one part of that I want people to listen very, very well. Now, diabetes affects every single cell in the body. One of my consultants says if he's asked to choose between hypertension and diabetes, he will gladly choose hypertension. You know why? Because hypertension affects just the heart and the blood vessel, the brain. But you see, diabetes, every place that the sugar, that blood takes your sugar to and passes, every cell in your body can be affected by diabetes. Now, I'm going to tell you this. I'm going to try as much as possible to explain this in as simple as this. When your sugar levels are high, that excess sugar kind of interacts with the blood and causes the body to start forming some kind of toxic metabolites that is very, very toxic to the cells. Now, those toxic metabolites will travel all over the cell, to the brain, every part of the body. The blood will just be taking it to every part of the body. And as it is going to every part of the body, those toxic chemicals, that's how they will be causing harm in every single cell in the body. You can see this diagram now showing the complications of diabetes. You can see that this diagram, there is no part of the body that is not left out. Just look at it from head to toe. There's no part of the body that is not left out from complications of diabetes. That is why it is very, very important that when you're diabetic, you must control your sugar level, because if your sugar level is not controlled, these are the things that you will experience. Number one, let's start from the head. From the head, stroke. Stroke is a major complications. People have diabetic stroke. Sure, diabetic stroke is so bad because it doesn't just affect one part of the brain. It sprays like a nuclear weapon. It's just, when you shoot a gun and the bullet pellet sprays. That's how diabetic stroke sprays all over the blood vessels on the brain. That's why you see people who and it's not diabetic stroke is not as dramatic as hypertensive stroke, but the things it can cause long-term issues, Alzheimer's disease, dementia, a lot of things, and all the early dementia and a lot. So the risk of stroke is high in one who has diabetes. Let's not even go far. The same brain, we are talking about the eyes. There's what we call diabetic retinopathy. It's another leading cause of blindness, and other among those who are diabetic or have chronic illnesses. See, diabetic retinopathy has caused irreversible blindness in a lot of people. Are we talking about only that? What about cataracts? And the increased risk for having glaucoma and all that, that is the eyes. We are not even going too far from that. If your sugar levels are high, of course, you will lose consciousness. Some people have coma and they even die off from the coma. That is it, as in total brain dysfunction. That is what happens sometimes when the sugar goes so high. Now, that when one is diabetic and sugar levels are high, the person can have increased thirst, and those thirsts can actually alter the balance, between how the brain manages the water in the brain. And before you know, either the brain is having a swelling up and one thing or the other. Those are the things that now lead to the unconsciousness that you see in most people who their sugar levels are very, very high. If they are not taken to the hospital as soon as possible, they can die off from that swelling and all that. Now we'll talk about we've talked about visual development. We'll talk about now let's go down. We'll talk about heart diseases. Heart diseases. Now, one particular part, when I'm talking about heart, I'm talking about both the heart and the blood vessels. Now, you see those blood vessels itself, diabetes can cause inflammatory, all those metabolites I told you I produce from the excess sugars that accumulate in your body system can actually deposit on the blood vessels and cause the blood vessels to become inflamed. Because of that, cholesterol will easily deposit. A lot of things will happen. The blood vessels will start to reduce in size. The space in between blood vessels will reduce. Blood will not be flowing as much as possible. So before you know, you are losing sensation in one part because blood flow is not very, very good to that part. Those are the vascular illnesses. Before you know, the person has lost, they will say, the person's blood is not flowing in the person's leg, or blood is not flowing somewhere in the person's body. That is blood vessels. Now the heart, diabetes can cause heart attack, what we call ischemic heart diseases. All of them, both myocardial infarction, that's cardiac arrest, and a lot of other cardiac problems, cardiomyopathy, so many of them. And most of the time, once somebody has heart failure as a result of diabetes, it's usually almost like 2-3 years for the person to be this person will not live up to 2-3 years, because hearts, they are most of the time it is difficult to get out of diabetic cardiomyopathy and all that. So you know how it is. So heart disease and diabetes, it can cause. So take note of that. Now, diabetes, we're still going down after the heart and all that. if it affects the heart, can it also cause you know, I told you about the blood vessels, how the blood vessels are damaged and all that, and how once they are damaged, like these things start to accumulate. If those things accumulate, they can cause clots, different clots of blood that can go and block the lungs and cause problems. So you see, diabetes is really, really bad. Now, going down, it distorts our, like, the digestive system somehow. There's one nervous system dysfunction. You know, the fact that we can be sleeping and our body is still digesting our food is because there's what we call autonomic nervous system that works even without our it's not a voluntary nervous system. It's something that works even without our control, you know. So diabetes can distort that nervous system and make the person gets full on time whenever the person eats, or the person is always having one tummy trouble, or always feeling full, or that. So that whenever, as in this complication, gastroparesis, the person cannot digest food as much as possible. Small thing the person will eat, person will feel full, and a lot of other things. Or the person might even have vomiting and a lot of other things. So that is the thing. Now, another thing again, I told you about infections here and there. Now, there's what we call lazy leukocyte syndrome. That's in that position, the blood cells, the white blood cells are supposed to be fighting against infection. The white blood cell now becomes lazy to see an infectious organism, and it cannot fight it because those metabolites that are dangerous have covered the face of that white blood cell. So normally they will not be able to fight against infection as they normally fight. That's why you see somebody who is not treating their diabetes, before you know, the person is looking like somebody that has HIV, you know, because the person is totally immunosuppressed, because the white blood cells are not fighting as much. So before you know, illness is everywhere. Small thing, the person has had infection. Small thing, the person have boils. Small thing, abscess. Small thing. Now, the one I must mention is diabetic foods. You know, whenever somebody comes to the hospital with diabetic foods, we used to say, this one has more than 1 or 2 or 3 systems that are already gone RE, because diabetic foods like a complex of a lot of a dysfunction of both the nervous system, the cardiovascular system, and you know, and the cardiovascular system and the nervous system. You understand? So once that happens, and even the immunologic system, so the body is not able to fight against infection, and the blood flow to the legs are not optimal, then the nervous system is dysfunctional. So the person is no longer feeling anything in under the leg again, or the person will be feeling as if needles and pins are choking the person up and down the legs. You see that person now will match nail, and the person will not even know that he has matched nail because sugar level is too high, and it has caused a lot of complications. He has lost sensation and everything in his skin and leg. You know, we had one patient one time that went to Mecca, and he was walking around that statue, and his shoe left his leg. He did not even know that his shoe has left his leg, and he kept walking. And by the time he was back from Mecca, his legs were burnt. You know, that's the thing. So that's diabetic food. I cannot forget diabetic kidney disease. Oh my God. Diabetes can shut down your kidneys totally. So you see, you can see how aggressive diabetes can be. It can be very, very aggressive. I said every single cell in the body, it affects it. It affects every single cell in the body. So that's how diabetes can be deadly. Can be very, very deadly if not managed properly. Next slide. Now, other complications, like for somebody who is pregnant now that has diabetes, and the person not managing diabetes very well, the person is going to give birth to a very big baby, macrosomic baby. And you know, once your baby is too big, it will lead to traumatic delivery, or even preterm labor, preterm delivery, and all that. Sometimes most people even lose their babies in their womb because of uncontrolled diabetes. You know, I've talked about immunosuppression. Then psychology, totally. The psychology of being diabetic alone, the burden of buying the medications every time, taking the medications every time, and all these things, and also the fact that you will be having complications, you will not enjoy the quality of life, can also lead to depression. Just like I even talked about diet, the fact that you cannot even understand what is the right diet for you, and all that, all the pressures, they are cooking different food from you, all those things can actually cause one to be depressed when one is diabetic and all that, and diabetes drugs now are so expensive. Even insulin is hitting the roof. So you see, it will surely bore a hole in your pocket, that's for sure. And once there's of course, once you're always going to the hospital, one complication or the other, of course you will enjoy the quality of your life, and ultimately it leads to death if not controlled properly. Next slide. Now, how can we prevent diabetes? Prevention is very, 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 very key. It is very important that we note that the two things that we must put into consideration when we are talking about prevention is nutrition and exercise. It is very, 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 very key. Nutrition and exercise. It is very, very key when we talk about prevention of diabetes. Next slide. Once you know that you are at high risk for diabetes, it is important that you start to check how much food that you are eating, as in tandem with your physical activity. You must be able to balance this. When I was talking about the causes of diabetes, I mentioned obesity. Obesity is one cause. That there was a lady that was morbidly obese, very obese, like all these people they show on TV, very, very weight. And she had diabetes and all sorts. And after she lost weight, worked on herself, lost weight, it was as though she was cured of diabetes. Yeah, because the obesity itself was the cause of her diabetes, and when she lost the weight, the cause of her type 2 diabetes disappeared. So that's the thing. So you have to be able to know what are the factors that you are predisposed to and actually work on it. Like, I had a friend whose mother was diabetic, and she knows that when we started studying, say, oh, I have a family history of this, so I think I need to be more careful. You start to eat right, she started doing exercise. Then she was really big. She cut down on her weight, so that carrying out exercise, eating very healthy, lots of fruits and vegetables. And up to now, I don't think I've ever heard that she's diabetic, because she knows that she has a risk factor for diabetes. Not only her mother, her uncles, have had diabetes for generations to come. So she had to watch herself to be sure that she's doing the right thing, so that she doesn't, come down with diabetes just like her other relatives. That's where the prevention now comes about. That's the thing. So you have to make a balance between more as in eating nutritious food and then regular physical activity. This actually will help you keep the right weight, stay healthy, and prevents you, as in gives you a low risk of coming down with diabetes or any other chronic illness. Next slide. Now, this is just a guide for you for nutrition. Limit saturated fats. You have to cut back on the total amount of fats you eat. So try as much as possible to reduce the amount of fats you eat. Try and eat more fiber. Eat a lot of fiber. We get a lot of fiber from our vegetables. We get from some grains. There's some grains that have, a high amount of fiber. So try as much as possible to make sure that you incorporate some fiber in your diet. Eat lots of fruits and vegetables. Try to ensure that you eat more. Now, try and eat smaller meals at regular times. Now, this prevention I'm talking about is not for those who are already diabetic. It's for those who have the risk of being diabetic and can prevent it. These are the things they should do. But if you're already diabetic, this doesn't work for you. So just, stay. This is not for you. This is for those who are not diabetic or who are pre-diabetic and can do something to actually prevent the diabetes from happening. So this is what you do. So you eat small meals. Learn to eat small meals. Time have passed when people used to eat akpu, fill up bucket of akpu and be eating. No, it's not amount. The truth is that living is not to live is not about the quantity of food you pack into your tummy. You understand? You have to. You don't have to eat to. You don't have to. You're not eating to add weight or to anything. You're eating to actually live. So you eat right. Don't pack too much of carbohydrate. Eat small meals with a lot of vegetable. Let that be your regular eating habit. If you don't have, if you've not been eating with a lot of vegetables, I think now is the time to incorporate a lot of vegetables in your food. Now, this is what vegetables can do for you. Now, vegetables have a way of controlling blood sugar. These are the various ways that vegetables have a way of controlling blood sugar. Number one, vegetables are high in fiber, and we know what fiber is. When you eat fiber, most of these fibers are not digestible. So what does it do? This fiber would trap a lot of the sugars, the food that you have eaten. You know, to trap a lot of food that you're eating and pull them down so that that's why people who eat vegetables stool a lot, as in when they go to toilet, they stool in quantity because the fiber, it cannot be digested. So it's going to trap some more food molecules and push it down. So you stool more. So it's a way of excreting the excess. You know, that's what vegetables do. Now, another thing again is that, you know, it contains a lot of vitamins. So those vitamins will actually help you, you know, to repair your cells and it can repair the cells and all that. Now, another thing vegetable does is that vegetable is very, very filling. When you eat vegetables and a lot of fiber, you will not eat too much before you feel full. So they have a way of trapping water molecules and make you feel so full that you will end up not taking too much as you would have loved to take. You know, that way is also helping to reduce your appetite, you know, and also control your blood sugar level. So you see how vegetables can actually help out. Imagine you have most of that in your meal, you know. You see how your sugar levels can actually be controlled by vegetables. So it's very, very important that you do that. And they add little or nothing to your calories, to number of calories that your body needs. So it doesn't increase your energy. So no stored energy, so that your body can concentrate. You know, like most people who are vegetarians, what the body does is that when you're eating only vegetables and the body needs carbohydrate or anything, it goes to the fats and starts to break them down, you know, to create energy. It now goes to the fats and breaks them down, take them, because you're not the little you're getting goes to the brain, you know. So if the body needs any extra energy, it goes fast. So that way they're eating a lot of vegetable and they are maintaining their weight. They don't add on too much. They maintain their weight because the vegetable actually helps out and reduces the amount of carbohydrate they actually end up taking in. So that's one thing. Now, another thing that kills most of us, you know, and even makes many of us to add a lot of weight is our dinner. Most people eat dinner by 10 o'clock. This is not good. You should eat dinner early. This goes to those who are diabetic and those who are not diabetic. Learn to eat dinner early because you're supposed to eat dinner and walk about a little before you finally go to bed. So if you eat dinner by 10 o'clock and you sleep, all the food that you have eaten will be stored as fat. So tell me how you're going to lose weight. And most of it will not be stored in the abdominal fat. That's a very, very important risk factor for diabetes. So learn to eat early so that your food is being used up a bit before and digest a bit through your walking around trying to take care of the house before you finally go to bed. If you go to bed eating heavy, that food is going to accumulate and make you add on a lot of weight over time. So that's the thing. And ensure that your night meals are light, you know, and if you eat light meals, it actually even help you to sleep better. So that's the next slide. Okay, exercise. I'll be brief about that. I'll soon be done. Exercise, you brisk walking, bicycle, swimming. Like now, the recommended exercise is 150 minutes a week. So you can split that to 30 minutes for 5 days of the week. Even just walking, brisk walking is okay for exercise. It doesn't have to be killing yourself. And if you can go to the gym, fine, it's beautiful, good. Go to the gym. But even if you can't go to the gym, you can just do a walk. You know, you can use a pedometer to record your steps. You know, those things can encourage you. Keep taking more steps today. Try as much as possible not to stay at the time. There was a research that showed that people that stay idle, sitting down, maybe inactive for more than 12 hours a day tend to come down with chronic illnesses, including diabetes. So you need to be active, put in some exercise in your routine. You know, exercise, even if you're somebody, my walk, I dey stand. It's not walk. Exercise, that one is not exercise. I've always said this thing, that one is not exercise. That one, your body is used to that. That's stress, that's work stress. When you take out time in a relaxed mood, go and do it. That's the one that your body will see as exercise. So that's what you should do. So make sure that you pick an activity that is enjoyable, you know, so that you can actually stick. Once you start to enjoy the activity, you can actually you can try to do a sport. You can go and play volleyball, play basketball, just do something that's enjoyable. And you know, you see, it can help you maintain your weight and act as exercise and do you good by preventing chronic illnesses. Next slide. Now, exercise, I cannot hammer these benefits more. It improves your circulation, your respiratory system. It can lower your blood pressure. It will increase. This one is very, very important. Now, studies show that as your muscles move about, you know, it actually improves sensitivity to insulin, you know, and all that. So it is very, very important that you move the muscles, you know, move your muscles. As your muscles are moving, sensitivity to insulin improves, you know, and all that. It can promote gradual weight loss, you know, helps you maintain desired weight, strengthen your bones and muscle tone, can improve your sleep. Exercise is very, very good. Decrease your stress, you know, and all that. And it actually makes you feel good about yourself. So it is very, very important, you know, but ensure that before you start to do something an exercise that is strenuous. Remember, it's supposed to be an enjoyable activity. Before you start to do something, don't do any exercise that is strenuous to you. If before you do anything that is strenuous, like maybe going to the gym to go and do the cardios and all that, please ensure you talk to your physician to be sure that you are safe and your heart is pumping fine before you go and do that. Next slide. Next slide. Okay, now this slide is just to give us an idea of how to calculate our daily calories, like how much calories we need for the day, you know, basically. So if you are a very active person, you know, these are the factors you use. When I post this on this thing, you can look at this slide very well. These are the factors you use to do this calculation. So you check your weight and then you times it by the factor that applies to you. If you know that you are sedentary lifestyle, you stay at home, you sit down at home, you don't go anywhere, you are always sitting down. Especially all these ICT gurus, most of them are always sitting down with their laptop. That is sedentary lifestyle. If they are leaving their chair where they are sitting down from laptop, they are moving from there inside the car to go and drive car. That is sedentary lifestyle. That is not active. So know where you place yourself, and you know how to time yourself. So if you're living a sedentary kind of lifestyle, you ensure that whatever food you're eating, your calories should not be as much as somebody who is active. You know, you can't compare yourself that is living a sedentary lifestyle, somebody who is a bricklayer that is jumping up and down a tall building, carrying cement. You can't compare yourself. Of course, two of you cannot eat the same thing. So you can use this to calculate your calories. Next slide. Now, so in order to lose 1 kg of weight, you need about 7,600. You need to burn about 7,600 calories. You know, this would actually even help you to set your weight loss goals. You can and to set those weight loss goals, you can actually work with a partner to achieve that. Next slide. This is very important. You must avoid taking alcohol or smoking. Smoking is bad for somebody who is diabetic. It is very, very bad, because if the sugar is already causing toxic metabolites that are destroying your cells, smoking will help it to worsen the outcome of that destruction. So, and even alcohol. So it's very, very important not to increase the toxins in your system. You're already struggling with a very good toxin that has combined with the extra sugars in your body. You will not want to add more toxins to it. So you should avoid this as much as possible if you're diabetic. So I think that should be the end of my presentation. Thank you very much for listening to me. Sorry for all the ups and downs in the beginning. I'm glad that I've come to the end of this presentation. So I'll take your questions. I think we'll have to take the questions on the. Do we take it on the group chat? What do you think? Should we take the questions on the group chat on the YouTube level? I can take your questions now.
Well, we have some questions answered on the group chat, and Dr. Michael and Dr. Eze answered some questions already.
Okay.
Unless we have new questions, they have been answering questions on the group chat already.
Okay. Can I have the questions? Or they
Oh,
have
okay.
answered them already?
Mm, unless you want to speak your own grammar on top, I can send them to you. I had some written down to send before they came and responded to them. So I'll send it to you in our private chat. You know where to go and check.
Okay. 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 First question is how does stress impact diabetes control? Then that's the first one. Okay, so I'll just take that one. Okay. Stress impacts diabetic control. Now, stress hormones, cortisol, there are stress hormones called cortisol and a lot of them. Most of those stress hormones are anti-insulin. They are like they antagonize insulin. So if you're stressed, actually, your control will not be your sugar control will not be very, very good because those stress hormones act on as in act against insulin. Stress doesn't have to be that stress where you are tired and all that. It could even be that you have an infection and you have fever and all those. So that is enough stress, to cause control. That's why if somebody has an infection or anything, sugar control is always erratic. It's always going haywire, that kind of thing. So stress has a very, very good impact to control. So that's why it's always important to, if whenever somebody has an infection, they're treating it. Whenever somebody is in a stressful condition, try to make it better. Talk to the person, make sure the person is relaxed and all that, so that you know that all things being equal, we're just addressing the direct issues. Now, the second question is how often does one need to check blood glucose level? Is there a specific period of the day that is better? Now, they are according to the standards. You're supposed to check your sugar levels in the morning by 6 a.m. 6 a.m. in the morning first. Now, some people will prescribe, if you want to do a thorough check, some people will say before breakfast and 2 hours after breakfast, before lunch and 2 hours after lunch, before dinner and 2 hours after dinner. Those are the important times to check your blood sugar levels. But because most of our people can't afford to do it so frequently, we suggest 6 a.m. is the best time to check for your fasting blood sugar. 6 a.m. Now, once you have checked that, that gives you an idea of your fasting blood sugar. You now start to do 2 hours after every meal. 2 hours after every meal. Now, 2 hours after every meal will give you an idea of your how your food and your drug balances out. Is your drug enough? The drug you're taking, is it enough to control how much food that you have eaten, or does the food overwhelm the drug? It gives you the idea so that you know how to play with the control, how to control your food, and then how to control your drugs. Now, if you come to the hospital with your well charted, you check your sugar level this way, and you come to the doctor can use it to really assess you to see whether your drugs need to be increased or whether your drugs need to decrease. So it's important that you know that these are the times you check your sugar level. 6 a.m. in the morning for fasting, and then 2 hours after every meal. You could check before and you could check after. It's actually that's those are the best times. Um, Now, yeah, somebody asked, is plantar fasciitis related to diabetic complication? Yes, plantar fasciitis is one diabetic complication. It's still it is still an inflammatory kind of reaction and infectious process, that occurs in diabetes. Is very, 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 very important. It's very, very, that some people that come down, plantar fasciitis is one very, very good complication, and all that. So it is a diabetic complication. So if you see that in a diabetic patient, you should look at the person's control. Now, does pregnancy induced diabetes resolve on its own? Yes, in some people. pregnancy-induced diabetes can resolve on its own. But if it doesn't resolve, then we'll now say the person is now chronic, is not a diabetic, as in pure diabetic. Some people get resolution after putting to bed, you know, and all that. But why some people it continues on. So that's why once after one gives birth, we keep following the person up till the sugar levels return back to normal. But if the sugar levels don't return back to normal, then we'll say that the person is now diabetic. So that's that. Now, the next one is, can you elaborate on hypoglycemic and hyperglycemic episode? Now, if one is hypoglycemic, that's the sugar level is low, hypo, low, down, low. It means that your sugar level has dropped so low, and it can cause a lot of problems. The first organ that gets altered, you know, when sugars are very, very low is the brain. You know, so you see, when sugar levels are very, before you know, the person is having tremors, person is becoming tremulous, sweating a lot, and before you know, the person can lose consciousness and, you know, collapse totally. You know, and all that. There was this a particular person who had low blood sugar, and at that time when the person had low blood sugar, the person was acting irrationally, almost fighting everybody, and we were wondering why the person was fighting everybody, you know. So when we got the history that the person was diabetic, the first thing we did was we tried to hold him and quickly check the sugar level, and we saw that the sugar level was low. Immediately we controlled that sugar level, the person was almost asking, what happened? So that's what hypoglycemia. So when you start to notice you're sweating excessively, feeling dizzy, your hands are tremulous, you know, and all that, and you start to, you know, almost lose consciousness. Those are the symptoms that we see mostly for hypoglycemia. You know, for hyperglycemia, most of the time, hypoglycemia is more dramatic than hyperglycemia. That's when the sugar level, hyperglycemia is when the sugar level is very, very high. Hypoglycemia is when the sugar is low, is usually more dramatic. Most of the time you see it coming, except in situations where this person is old. It's only people who are old that may not be able to notice that their sugar level is low, because they have lost all the nervous system that's in charge of, you know, giving those symptoms of low sugar are all not working properly. So we don't expect an elderly person to express that hypoglycemic symptom, but normal, as young people do experience hypoglycemic symptom. Now, for hyperglycemic episode, when the sugar level is high, is not dramatic. Sometimes the person will just be sitting with you, and the next time the person is unconscious. It's not dramatic as per the person with tremulous or anything. It's not. The person will just become unconscious. And when you're checking the sugar level is unrecordably high. There was this patient we had that because he heard that, oh, you should take fruits, he now went and took almost 10 mangoes. And immediately after eating the mangoes, all of a sudden he became incognito, as in became unconscious. By the time they brought him to the hospital, his sugar level was unrecordably high, very, very high. So we had to bring down his sugar level as much as possible before he regained consciousness. So when the sugar levels are high, you can lose consciousness and all that, as when the sugar levels spike so high, you know, and all that. So those are that's the difference between hypoglycemia and hyperglycemia. Now, somebody said, what's the relationship between boil and diabetes? That boil is skin infection. It is infection of the skin. The relationship is that diabetes causes immunosuppression. So you are predisposed to having infection. So any bacteria on your skin can cause an infection before you know you're having boil. That is boil. That's infection of the skin. You know, that is it. So once you start to have frequent boils, check your sugar level. It may be that your sugar level is high. That's why you're having the frequent boils, or it may not be. I'm not saying that it is directly proportionate that when you have boils frequently, you are diabetic. No. But if you're having repeated boils, please, it's very, very important that you check your sugar level. It's very, very important because these are the things that predispose to things like that. So that's it for those questions. Any more questions? Any more questions? Hello? Okay. Yeah, if the person is not, if the person has the boils and frequent boils and is not having diabetes, then look for what is actually, you have to look for what is causing your immune system to be so low that it cannot fight a simple skin infection, that you're having repeated skin infection. That means something is happening, your immune system is dropping. You understand? Skin infections, the skin is well covered with enough fighters, enough to fight off infections. You know, so when you are having repeated boils and it's not diabetes, look for something else that is suppressing your immune system enough that you're having boils frequently. So it's very, very important to stress that. Yeah, yeah. Okay. Somebody says, the myth of diabetes being hereditary. What if there's no case of diabetes in family? Yeah, I said it earlier that the fact that the fact that nobody has diabetes in your family does not mean that you cannot come down with diabetes. What causes diabetes is not just that you must have it in. That is not genetics. Is not the only way you can have diabetes. If your lifestyle measures are not well in place, you can come down with diabetes. So it's not only genetic factor that we will look at, that will say, okay, because this person does not have it, then you can have 3 generations and there's no diabetes in your family. There's no single person have diabetes, and all of a sudden you come down with diabetes. There are many, many things that can make somebody come down with that. Now we have a lot of autoimmune disease. We have so many things in the environment that are toxic to our pancreas, our system regularly, and all those things, and also our lifestyle choices, the kind of food we eat, our physical activity, and so much more. All these things predispose us. So if you're not living the right and healthy lifestyle, you can come down with diabetes even if there's nobody in your family that has diabetes. So that's that. Aha. Okay, good. So somebody asked that, can diabetes make one begin to talk off points? Please, if you see anybody that is diabetic and the person is talking off points, please try and, as much as possible, and make that person to check his or her sugar level. Immediately you sense that, oh, this person is diabetic, and the person is now beginning to talk off point, please let them quickly check their sugar level immediately. That's the help you'll be having, because it could be that their sugar level is very high or very, very low, and they start I told you now of a patient that was almost fighting us in the hospital, in the ward, was blowing everybody, not allowing anybody touch him. We held him down, check his sugar level, and his sugar level was very low. As we immediately we corrected it, the man was asking us what happened. He didn't know where he was. He was irrational totally. So that's why even normally, once a person comes into the hospital and the person is unconscious or the person is acting somehow, the first thing we do is that we check the sugar level, because we must be sure that everything is all right. So you understand? So when somebody is diabetic and the person is talking to you irrationally, please look for a way to check the person's sugar level. You might be helping the person. Any more questions? My cup. I'm late. Yeah. Hello. Any more questions? Yeah. Any more questions?
I can't see any questions. Nothing is coming up.
Okay. So, and in the absence of no other question, maybe I'll just take them. You can still ask them on the group. I'll take them as soon as I can on the group
One
chat.
last question.
Right?
One last question.
Okay. Okay. Oh, God! How did I forget this one? How did I miss this question? For goodness sake! Yeah. Please, you see, erectile dysfunction is one major complication of diabetes. Is a major complication of diabetes. You understand? Now, we've had. Sure, those are the things that actually even cause depression. You know, erectile dysfunction. That thing can really worry men very well. You know, and diabetes is a major factor. So, if you go to the hospital and you have erectile dysfunction, and you tell your doctor you have erectile dysfunction, I bet you the first thing your doctor will do is to check your sugar level, check your blood pressure, and all that. So, erectile dysfunction is very common. It's a common complication of diabetes, and most of the time is once one has erectile dysfunction, most of the time it depends on how soon it was discovered. It may be irreversible. We had a patient that's late now, and that patient had erectile dysfunction that that affected his marriage. His wife left him because of diabetes, you know, and he did everything to take care of the erectile dysfunction, and everything, including getting a pump and everything, you know, but nothing. There was no headway with the erectile dysfunction because his sugar control was not optimal at all. We kept hammering to him, you have to control your sugar, you have to control your sugar, but he never got the hook of it until he passed on. You understand? He was busy chasing the erectile dysfunction. Meanwhile, he was busy chasing erectile dysfunction. Meanwhile, his problem was controlling his blood sugar level. So, it is very important that you make sure that you don't, if you are diabetic, you don't get to that level of erectile dysfunction. Don't get to the level of erectile dysfunction. You understand? Most of the time, it's usually not easy um, to manage. So is a major complication of diabetes. Any more? Yeah, I think I saw one more question. Someone like any cure for diabetes? There's no cure for diabetes. Yeah. So diabetes can be managed. It can be cured. So just remove your mind from cure, and stick with the management of it, and you see that your life will all be good at the end of the day. So that is it. I think that will be all for now, my dear. I'll see you on the group where we'll continue the discussions. So keep your questions coming. I'll address them as I see them. Thank you so much for giving me the attention, giving me the support. Thank you, the media team, for always coming through. You know, thank you everyone for attending the session. See you again
Thank
before
you
the
for your
year ends.
time.
Thank you. Good night.
And a good night.
Yeah.